The future of your health, I'm sure it is something that you think about quite a bit, but how much control do you have over your own health?
Great question. And right now, an expert health advisor to the U.S. Army who has just spoken to the World Health Organization and United Nations on how we can all determine the future of our own health is here in Boise. So let me introduce you. This is Matt Riemann. He is an author, an educator, and a leading expert in personalized health and future medicine. And he joins us now to talk about some of the issues that we're facing now. So, Matt, what are you seeing as some of the biggest health issues that all of us are facing here in our country right now?
Yeah, well, I guess there's two fundamental issues, and the first is the significant epidemic that you're seeing in the chronic disease. The second is the healthcare system that's going to support that. And so we look at some pretty alarming statistics about the fact that 10,000 people are going to die from diabetes today. We've got 13,000 people die from heart disease today. There's over 100 million Americans that are obese right now. And the great news that we've just got from the National Cancer Institute tells us that 1 in 2 of us are going to experience cancer in our lifetimes.
1 in 2?
So we've got quite a big issue that we need to sort out, and the system and also the disease state is really what we need to be focused on. So
you think that the system and the individual aren't working together yet? Is that what you're kind of saying? If I'm reading into what you're saying are the two big issues here?
We've got a few areas that we need to focus on, and I guess probably short of time I won't be able to give you all the answers today, but there's 3 really big perspectives we need to be considering in where we're going for the future of healthcare. And so we look at the move towards more of a functional medicine. And what that means is where medicine's practiced more on the what at the moment, so the what medicine, we look at what symptoms do you have, what sort of disease, what sort of diagnosis, what the management is for that disease, and moving towards more of a functional approach, which really is the why medicine, looking at why that's there in the first place, and really trying to find the root cause of the disease. And so that shift is gaining a lot of traction. In fact, the Cleveland Clinic, I think this week, is just talking about bringing that on board and embracing that, which is quite big over here. The second thing that we're looking at is from a personalised health perspective, and we're shifting from the standardised healthcare towards personalised health. What that means is where we have a lot of the interventions at the moment that are based on general population and population science and research, we're moving them more towards personalised health, which really looks at the genetics, and so our DNA, looks at our epigenetics, which are the factors that influence the way our genes are expressed, like our lifestyle environment, and looks towards a lot of other factors there that we can really affect and influence ourselves on, such as the foods we eat, the exercise we do, the sorts of interactions that we have, and even from our careers and our natural talents. The third perspective is certainly the incorporation of digital health and digital technologies, where we have a lot available now on our smartphones that can measure our blood pressures, our heart rates, our REM sleep. They can even through to measuring brain waves, can look at our stress levels and our emotional status. So the future of health is bright as long as we can look towards incorporating all those components together.
And taking ownership. That's what it really sounds like, that individuals have to take that ownership. Real quickly, though, and we're putting up where you're going to be in town. It's really neat to have you here. When do you think you see these changes happening? We hear the talk.
Sure.
But are these years off, decades off, or months off?
Yeah, well, there's some great tips that people can implement right now in their lives, which is really quite easy. The first, talk to your doctor about a personalised health plan and get that conversation going. The second, start to take some ownership of your health and really understand that there's some great personal health tools out there right now. There's some great companies like 23andMe that you can look at your personal genes. There's ph360 where you can look at your personal epigenetics. There's organisations like Singularity University where you can look at the cool biotechnology that's coming, and really to embrace that and take ownership of that for ourselves is a really easy thing to do now. It's accessible. And the third is just understand that you're unique, you're different, you know, we're all different, we all need different foods. The person on the bus, your mum and dad, what worked for them, and if they did the paleo diet and the juice fast, may not work for you, and chances are it won't. So find out how unique you really are and take ownership.
I can see some of our viewers out there taking notes.
I know it.
Fast and furious, but you really can go and hear much more from Matt. As you saw here on your screen, we've got a couple of events at Saturday, 9:30 to 12:30 at BSU in the Student Union building there, and then also on the September 13th date from 10 to 11:30 also at BSU at the Student Union building. But really great message about taking control, and thank you for being here.
Matt, where are you from? I love your accent.
From Australia, from Brisbane. So I'm still trying to learn the Boise accent.
Oh, but you got Boise down, and we appreciate that.
We're getting there.
Nice.
Great.
Cool.
Well, you're here on a beautiful day. Another shot outside for you. Rick's standing by. He's going to tell you all about the forecast when we come back.
My name's Aaron, and I'm in the veterinary technology